fall and winter seasons bring crisp, cool temperatures, and it also brings coughs and sneezes that make so many of us feel miserable this time of year. So here with the tips on what we need to know as we head into the lovely sick season is Dr. Vinitha Moopen from WellSpan Family and Pediatric Medicine at Rossville. Good morning. Thanks so much for being with us.
You're welcome.
You know, this time of year, there is just a box of tissues permanently attached to our kids or ourselves. We're in the middle of flu season. We know COVID is making a comeback as well. So first of all, what are you seeing at the office right now?
Right now, we are seeing a few COVID cases. We have some strep. We haven't really started seeing flu or RSV right now, but we are seeing non-COVID, like upper respiratory infections and sore throats and a couple of stomach bugs here and there.
And kids have been back in school for, 2 to 3 weeks now.
Right.
This is when normally things start to pick up, right?
Exactly. And so we have seen that pick up definitely. We've had a couple of cases of pneumonia, and a lot of kids just out for the day or two because they just don't feel well because they picked up something at school.
So when it comes to vaccines, we know people can get the flu shot, and WellSpan is also offering the flu shot and COVID shot.
Yes.
They are separate or together right now?
They are separate.
Okay. But can people get those at the same time?
Yes, they can. Anyone 6 months and above who's eligible for the vaccine can get both of them, or either or at any of the locations that offer vaccines.
Now, if you're already feeling sick, should you not get either of them?
So, like a contraindication would be like if you have a fever, I wouldn't get a vaccine. But if you don't have a documented infection, or you don't have the flu or you don't have COVID, it's fine to I would speak to your doctor and then make that decision.
Obviously, over the last couple of years, there's been a lot more talks about vaccines than we used to have. The versions of this now, are they different from what we saw a couple of years ago? Are they different for kids, adults?
So it's the same vaccine. It's just there are two, the Pfizer and the Moderna are still our mRNA vaccines for COVID, and they're still, they're trying to make them as close to the current strain as possible. So it is different in that respect because it's a different strain, but otherwise it's pretty much the same.
Now, we know this is also kind of starting to be early, but for the time of RSV as well. What does that look like in terms of vaccines?
So we have vaccines for pregnant women, and we also have vaccines for newborns up to 8 months of age. Last year we had issues with production, so we weren't able to give it as much as we wanted to. The season usually starts in November, and we will have those vaccines available at that time as well.
All right, so if someone's watching and they're like, all right, I don't want to go through this again, hopefully we can prevent, our kids, our family, and everyone else from getting sick.
Yes.
How can they schedule an appointment for a vaccine?
So either they can schedule through with their primary care physician if they're with WellSpan, or we have flu clinics and COVID vaccine clinics that you can schedule as well. Just call into the office of your choice.
All right, so just keep an eye on that. Dr. Moopen, thank you so much,
as
always. We can also have that information for you. It's going to be on fox43.com.